Hi, and welcome to the Pet Healer Podcast. This is your host, Dr. Mitzi Vargas, and today we're going to talk about vitamin C. I know my episode on vitamin B12 generated a lot of interest and questions, and I decided to tackle another important vitamin, vitamin C. And there's a little controversy between allopathic veterinary medicine and alternative medicine in the use and need, actually, of vitamin C. Um, so I'm going to focus a little bit on the talk on the IV infusion of vitamin C. But right now, we're going to just start the conversation by what is really vitamin C. So it is a vitamin that is an antioxidant. Everybody knows, right? Oh, now with the COVID, the pandemic, everybody's taking a lot of vitamin C. I myself take 1 gram a day. And I really think that it definitely improves our immune system function, and it helps us fight colds and flu and obviously COVID. And it definitely helps in other things that we may not be so aware of. In people, at least, it helps with wound healing, with depression, with fatigue, with allergies, and with other like neurological conditions. But it is also an alternative cancer therapy. Adjuvant most of the time, that means with chemo and with radiation or with other intervention. But it's definitely a great helper when it comes to the fight in cancer. Alternative or integrative view of it. That's what we're going to focus today. But the vitamin C, the controversy it arises because allopathic medicine says vitamin C is supplemented in the dog foods, it is water soluble, and you shouldn't supplement the dogs. Um, I think that is harmless to go a little bit high on it. It can only benefit them. Uh, but there is a little exception. Those dogs that have problem with bladder stones, especially calcium oxalate stones, should not take extra vitamin C. And the reason is that vitamin C gets processed, and one of the byproducts is oxalate. And of course, that will contribute to the bladder stones on those dogs that have a metabolic issue and produce stones made out of calcium oxalate, because of course the excess vitamin C is going to be excreted through the kidneys to the renal system, and that's where it's going to collect, form the crystals, and then they form the stones. So other than those dogs that have that issue, or cats, I would definitely recommend the supplementation with vitamin C. And the reason, my main reason, is if you're feeding a commercial diet, that diet has been made probably 10 months by the time that you receive it, because it's been stored, transported. I mean, it's been cooked at high temperatures. A lot of the things that were put originally in the blend, they don't survive that road, or might be diminished, and not in a good way. So it could be that it doesn't even get to the requirements. So the vitamin C, again, going back to the vitamin C, has a lot of history. Um, the Linus Pauling, the guy, the chemist, famous chemist that won the Nobel Prize for his discovery, started using vitamin C in patients with cancer. Um, and it just so happened that my father-in-law, rest in peace, he studied in Heidelberg, Germany, and he did have some, um, you know, Linus Pauling was one of his professors, and he always believed in vitamin C, and he always believed, like Linus Pauling said, to take 2 to 3 grams of vitamin C a day. So that's what he took all his life. He passed away earlier this year, but it is very interesting because in his family there was a high incidence of colon cancer, and he never had any problems. So hopefully, was a protective effect of the high doses of vitamin C he took throughout his life. Um, but even the National Institutes of Health have studies demonstrating effects of the vitamin C against cancer cells. But again, I'm not gonna jump to the cancer cells. I'm gonna go a little bit of what does it really do, the vitamin C? Well, it is a it is an anti-inflammatory for sure. It acts as an anti-inflammatory, and if you have it at high concentrations, like when you do an IV infusion, then it generates a production of hydrogen peroxide, and hydrogen peroxide will kill cancer cells, especially in the early stages of cancer. Um, Sometimes your pet has been diagnosed with cancer, something that can be treated. However, there are other situations like heart disease, advanced heart disease, or perhaps other organ dysfunction. Perhaps your pet is so weak that chemotherapy is not in the best interest or radiation is not in the best interest. Then IV, intravenous infusions of vitamin C, could be a big part of the approach of an alternative or integrative approach to control or defeat that cancer. Um, there are other things that you can combine with the infusions of vitamin C. Most often, people use mistletoe preparations. So mistletoe is also is a parasitic shrub, right? Mistletoe. Everybody knows at Christmas, everybody has the mistletoe and they kiss under mistletoe. Well, the mistletoe um, kills cancer. It has some anti-cancer properties, and I'm gonna talk about mistletoe in another future episode. But I just wanted to give you a little a teaser that mistletoe is being used in a lot of the integrative or alternative medicine clinics that are treating cancer. And again, cancer is such a big problem for our pets nowadays, and the Western chemotherapy can be extremely expensive, and sadly, some of the times you don't have great survival times for certain cancers. Okay, for others, not so much. So the vitamin C infusions and the mistletoe injections, which are subcutaneous under the skin, are a good pair combination. I see it a lot often. At our clinic, we're using IV vitamin C for pancreatitis and for septic cases. So if your pet is in a lot of distress and is fighting a big infection, we do have IV antibiotics, and we can also do an IV infusion. Now, the vitamin C has to be given very slowly, about an hour. It takes about an hour to give it. It's a little bit cumbersome, to do because you have to be on it. But it definitely, acupuncture, herbal therapy, nutritional approach, mistletoe. I mean, this is the combination that you're going to see when you seek palliative or alternative care for cancer, or for any of those conditions that are very advanced, and which allopathic medicine cannot do much for. Each animal is an individual, and the dose is going to vary with the type and the kind of cancer that we're dealing with, or kind of condition. If you're doing pancreatitis, it's a little bit lower dose. Higher dose usually is the most used in cancer because they're more pro-oxidant, and that's what you're looking for. So a lower dose of IV vitamin C would be used for pancreatitis. That's definitely available at our practice and in multiple practices that are focused on the integrated medicine. And these infusions, usually I just say if you're with the cancer, usually before or after, right after the going through the chemo or the radiation, to have the infusion so that you have a boost to the immune system. If it is to treat a disease like pancreatitis, obviously when it's in the hospital with the IV and receiving all the other medications for it, then that's when we will do it. So the dose for the vitamin C, dose per day orally, because I wanted to talk about that too. What's the dose that I recommend? And I wrote it down because, I didn't want to forget to talk about that. But the small dogs, 125 milligrams, which is what I use for cats, 100 milligrams is for cats, 125 to 500 milligrams per small dog. And you can split that in two. You don't have to do it all at once because it's a little acidic. So, or you can give it with food. That's not a problem. And then for a medium dog, 250 milligrams to a gram. Now, if you're dealing with cancer or with other condition where your animal is weak, I would say 1,500 milligrams, a gram and a half. And for a large dog, more or less the same, between 500 milligrams to 1,500 milligrams. I would kind of cap it at 1,500 just because of what I mentioned about the metabolic situation with the vitamin C being created into oxalates. So, when we're talking about vitamin supplementations, not just C or B, those are water solubles. And so it's very hard to harm the pet by giving the extra ones. It can only, in my opinion, it can only do good unless you have bladder stones. And the other vitamins that are fat soluble, like vitamin D, that's a little bit more difficult to say if you need to supplement. I rather, when it comes to vitamin D, I rather you give a teaspoon of very high quality sardine oil or salmon oil, and that will have the vitamin D and the omegas that your pet needs, rather than you giving vitamin D. Because even for ourselves, it's a little bit hard. And now with COVID, again, that's vitamin D is another one that gets mentioned a lot. And it has been proven that people that have the low vitamin D have worse outcomes when they go through COVID. And being that I recently went through COVID and it was, thank God, very mild symptoms, I have been taking vitamin D all this time, even before the pandemic, and taking 20 minutes of sunlight every day. And that's what you need as a person. And for our pets, spending some time outdoors is definitely enough. And then whatever is supplemented in the food. As a matter of fact, there are many recalls. If you look into Google history, you can see even great companies like, like Royal Canine even. They have had recalls for incorrect dosing of vitamin D. And the reason they recall tons of food and lose a lot of money, it's not because they're kind and nice, it's because they fear that some dogs may actually overdose on vitamin D and die. So definitely there's a big difference between supplementing with vitamin C, harmless, and vitamin D, deadly. So there's not big difference between the two of them. So I recommend that you follow the advice of your veterinarian, obviously, but that you look at what quality of the food that you're feeding and the quality of the supplements that you're giving your pets, and not exceed the recommendations, but at least make sure that you're in that goal range that I mentioned. And vitamin C, again, it's synonym with a good immune system, and our pet's immune system could also be exaggerated or exacerbated, and in that case, that would cause too much a reaction. So, for example, allergies, it's a dysfunctional immune system, but it is caused by the exaggerated response to a normal thing in the environment. So pollen is in the environment. Why do our pets go crazy with vitamin with itching and scratching. Well, vitamin C could be key to using these supplementations to help treat allergies. In people, there's a lot of beauty products that contain vitamin C, and it is because they call it regenerative. It helps the collagen structures. So there's not such things that are topical for pets and cats, dogs and cats, but there is the oral supplementation of vitamin C that could help not just with all of that collagen, antioxidant, immune boosting, but also it can help with the immune modulation. So modulation means not too much, not too little. So just trying to have the appropriate response to the environmental threat. And pollen is really not a threat, except for our cars. But for our pets, it shouldn't be. And so try, if you have an allergic dog, try supplementing with vitamin C, and let's see how it goes. I hope that you learned something today, and we are going to, sporadically go through certain vitamins and supplements that are very common. And if you have any questions, please send me an email, and you can go to thepethealer.com, to our Facebook page, The Pet Healer Podcast, or just subscribe and contact us in one of the platforms where a podcast is being broadcasted. So thank you so much, and I'll see you on our next episode.